Hello, good afternoon and good morning to those of you joining us from the West Coast. Thank you so much for spending your time with us today. While we wait for more people to join the chat, we'll just take a minute, or excuse me, join the webinar. We'll take a minute. Should you want to post where you're joining us from in the chat, we'd love to see where you're calling in from. Fantastic. This goes so fast, seeing so many different states, East Coast, West Coast, and everywhere in between, it looks like. Very cool. Nice to see. I know we have a very packed schedule today, so I'm not going to wait too much longer before I just start with some of the housekeeping things. First and foremost, my name is Kristen Kopenever, and I am the Director of Admissions here at Wayne State University School of Medicine. We have, as I said, a full program for you today with some of our student affairs experts and incredible students who are with us and are ready to share information about what kind of opportunities they've had and what kind of opportunities exist for Warrior MDs to get involved and have an impact in their communities locally and globally. But before we begin, of course, housekeeping, please note microphones and cameras are automatically off and will be disabled for this webinar today. You do have access to the chat. Please feel free to put any questions or comments in that throughout the webinar. We're going to try and get to a Q&A at the end. Because we have so much content to get to, I'm not sure how many questions we'll get to, but we'll try our best. We have a great team of admissions professionals and our students, of course, who are probably going to answer a lot of your questions as the webinar is going, as they most often do. So if you do comment in the chat, please make sure you click to send your chat to everyone so that it's not just going to hosts and panelists, so that everyone can see the question and everyone can see the answer. And please note that this webinar is part of a series by the Office of Admissions. And should you wish to learn more about anything from our curriculum to clerkships, research opportunities, and much, much more, you can hop on med.wayne.edu at the bottom, and there's a footer YouTube icon. Click on that for our webinars. So now, before we begin the program, I want to be sure to introduce Dr. Patrice Harold, our Associate Dean of Admissions, to provide a brief welcome. Dr. Harold.
Thanks, Kristen. Hi, everyone, and welcome to Wayne State University School of Medicine. As Kristen said, I'm the Associate Dean of Admissions and a proud alumni of the class of 1989. You guys are going to hear a lot of information about what our students are doing, the opportunities they have, and the impact they have on our community, both locally and globally. So sit back, relax, and enjoy this webinar series. And hopefully you see something you align with, and one day we'll see you here as a Warrior MD. Thank you.
Sounds good. Thank you so much, Dr. Harold. So I am going to flip through the slide. If everyone can just give me a thumbs up, but panelist-wise, that they can still see this because I lost okay, sounds good. Thank you very much. As many of you already know or may know, we've been around for a very long time, nearly 160 years now at this point in the heart of Detroit, and we provide hands-on clinical experience from day one. We're a top-ranked Carnegie ranked research institution known for innovation, leadership, and community impact. So we like to say, if you train in Detroit, you can serve and excel anywhere. So before I start this slide, I want to introduce my wonderful co-host, who is our class of 2027 Warrior MD Ambassador, Christian Turner, who's going to help me go through a few of these slides up front and just kind of talk about the curriculum a little bit and just how the curriculum helps our students to be really prepared to go into the community. So Christian, without further ado.
All right. Hi, guys. Can you hear me? I hope so. Anyways, nice to meet you guys. Again, my name is Christian. So really quickly, just a couple of things about our MD curriculum. It's broadly divided into three segments. There is your pre-clerkship years, your clerkship years, and your post-clerkship years. We're mainly going to be focusing on the pre-clerkship years because I think all of us here are pre-clerkship students, so that's what we can speak to the most. In general, though, like how this works is that we have an 18-month pre-clerkship curriculum. First year, or segment one as we call it, is 9 months. Segment two is another 9 months after that for 18 months in total. Each segment or like year, if you will, is basically segmented into three blocks, each one being roughly 3 months long. Your first year, you're going to be focusing mainly on learning how like the body functions normally, so like all of your anatomy and your physiology. And then second year, which is what we're doing all right now, is when you add in the pathology part to that, and that's when it gets really interesting, in my opinion. A couple of highlights that I want to just include off the slide is that we do have a year-long longitudinal anatomy program, full dissection. This is definitely a highlight of our curriculum, in my opinion. We are one of the only medical schools that still does this. And so, if you're interested in anything that is heavy on anatomy, procedures, anything like that, or really like no matter what you do, anatomy is going to be in the back pocket of pretty much any physician. And so, that's a great experience. Another thing I wanted to highlight is that we have 4 week-long breaks that basically correspond to just a week in between each block. And then you also get 4 weeks between first and second year. This is great for wellness, prevents burnout. And as we hear often, if we are burnt out, then we can't really go out and serve the community, which is sort of the theme of today. And so this is great for, helping us be at our best. Next slide, please.
So, and the next slide talks about our population, patient, physician, and professionalism course. That is a longitudinal course within the curriculum designed to help students provide patient-centered and culturally responsive care, become effective team members, learn evidence-based frameworks of care that reduce healthcare challenges, foster self-directed learning, and so much more. And this course, among many other things within the curriculum, they're all very much designed to help our students take what they're learning from the course, from the curriculum, right out into the community as well. Christian, I know you have some talking points on that too.
Yes, so P4 is awesome. This is one of the other longitudinal courses that spans throughout first and second year. So, like our main course is Human Body or Human Disease Foundations, talking about all of your like traditional didactics, like physiology and that kind of thing. But then we also have some of these side longitudinal courses, one of them being P4, which is Population, Patient, Physician, and Professionalism. As Kristen alluded to, this is a great opportunity. This helps us not only learn how to provide culturally competent care in an incredibly like diverse metropolitan area that is Detroit, but also like particularly starting in second year, we like specifically learn how to best treat certain patient populations. So like veterans, maybe patients with disabilities, maybe patients that are in the correctional system right now, or maybe have been in the past, like maternal fetal health. How do you navigate situations where somebody might not speak the same language as you? And so, like, this is a very great course. M1, it is mainly small groups. And then starting second year, it's sort of a mix of a small group as well as a sort of like a panel base where, like, they not only bring in like experts in the field, but they also bring in, maybe patients from the population that you're talking about today. And so it really helps us feel ready and prepared to serve whoever we need to serve out in the community.
Thank you, Christian. And of course, we also embed service learning right into the curriculum. All students are annually required to complete 35 hours of service learning with local agencies and student-run clinics as well.
Yeah, so this also is a fantastic opportunity. Service learning is also a longitudinal course all throughout first and second year. And as Kristen mentioned, we actually go out and complete a certain number of hours out in the community. Typically, the minimum is 7 hours, but honestly, most people do a lot more than that, including myself, because it's great. And basically, like you can participate in like student-run free clinics. We have a couple of students here in a few minutes that can talk to you about specific examples. Pretty much any sort of outreach program you can think of, we have. Like one of my personal favorites is Back Alley Bikes, which is pretty cool. So basically, like some guys go out in the street and they basically like pick up like old bike parts or bikes that are not in use, and then they fix them up and then either give them to like the people of Detroit either for free or at a like significantly discounted price. And so I like to use that example because really like if there is something that you can think of that can help the community, there's a good chance that we are doing that. And so this is a great opportunity and I think one of the biggest drawing points of our school.
Thank you. And finally, on our end, before we get to Dr. Waino and our students here, our students get hands-on experience from the start of medical school, thanks to our Cato Family Clinical Skills Center. Also part of the curriculum, the clinical skills course, the center provides a safe space for critical communication, physical exam, procedural, and reasoning skills that students will use from day one throughout their careers.
Yes, and so clinical skills is also great, another longitudinal course. And as Kristen mentioned, essentially, like this is where you learn how to quote unquote like be a member of the healthcare team. So like how do you get a history? How do you get like a review of systems? How do you do detailed physical exams? How do you come up with an assessment of a patient, a plan of a patient? Like we are starting to work through illness scripts, like particularly in second year. So how do you come up with a list of differential diagnoses? How do you present a patient to your attending physician or other members of the healthcare team? And so like you actually start this basically, I think your first or second week of medical school. I remember my first clinical skills were like I learned how to take a history. The only thing I had learned in medical school is that the mitochondria is the powerhouse of the cell. And we were already learning about how to be more effective in the clinical setting. And so, of course, this really helps us, get set up so that way when we go out into the community, we can have maximum impact, which is great.
Thank you very much, Christian, for helping provide that short glimpse into our curriculum. Again, should anyone be interested in learning more about any of those areas, we have webinars, I think, on pretty much all of those things, so check those out. It is now my pleasure to introduce Dr. Waino, our Assistant Dean of Student Affairs, to give an overview of student organizations and engagement opportunities available to Warrior MDs. Dr. Waino?
Thanks, Kristen, for the kind intro. I'm really excited to be here. Uh, so I went to med school here at Wayne, and I really remember this year of like anticipation and hopefulness before the year started. And I remember when Don gave that like phone call to me and said I was in. So you guys have an exciting time ahead of you. All right. And it's nice to be able to be in a position to talk from like an administrative side about student organizations and engagement, because I remember being here as a student and getting to do some of these things. So next slide, please. So this gives you a sense a little bit about what we'll talk about in the next few minutes, a little bit about the logistics, the personal impact for students, as well as the community impact of service for what some of the student organizations do, connecting student orgs with your own professional development as well as scholarly work. And a little bit about what I'm hoping is through these next slides, you'll see a little bit about what makes Wayne State so special. Next slide. All right, so you guys are gonna be here soon. There's a beautiful white coat ceremony to start things off. We love to celebrate at Wayne State, and there are some amazing areas in Detroit where we get to host some of these major celebrations. So this is the very beginning, right? Next slide. And one of the things, because getting dressed up, having family and friends come, that's all really fun. But really the beginning is the first few days of orientation, which are all in person. And then there comes the medical school Warrior Olympics. And I tried to pick a few pictures, there's so many to pick from, that like get a little bit of a sense of what it's like there to be out there and be making some of your new friends. Next slide. And then we have over 130 student organizations. All right. So I'm not listing them all because it's like not possible to they would fill up so many slides, right? But it gives you a sense of what's out there for you to be able to connect with peers for. Next slide. So this is just a little snapshot to be able to demonstrate some of the student organizations and the major categories that they are in, that we had some of our students from our board of student organizations update this most recently, and be able to get a sense of like there's a lot of ones that focus on clinical work, and that is clinical work that is right there in the Detroit community, serving patients that have a lot of trouble accessing care normally. But there's also a lot when it comes to creative hobbies and interests, identity, cultural, and faith-based student organizations. There's a number that connect with national organizations, a host of specialty interest groups, and a lot focused on service education and outreach. You can also see with this many student orgs, one, you find something that kind of speaks to you, both for your professional development as well as to just have some fun with colleagues. And then the other piece of it is that there's really an opportunity for leadership as well, right? Because each of these student orgs have student leaders, and maybe we can go back to the students too to be able to give some of their information and firsthand, more recent experience about this. But I think part of what makes Wayne State special is really people wanting to connect with each other and with that community. So I see a few of those questions in the chat of like, man, do we really have time for all of this? So you are not going to have time to be part of all 130 of them. All right. But I think you will have time to pick what speaks to you and be able to connect with your new colleagues that share some of your passions and find some new ones. Next slide. So to highlight just a couple of the clinical oriented student organizations here, one is Street Medicine, which has been around for a number of years now. All right, it's really an established organization, but it's gone through multiple expansions in recent years, where there's actually a consult-based section in one of the hospitals where when an unhoused patient is hospitalized, the student org can be contacted to help the clinical team be able to connect somebody to services at discharge. And there's a new one. There's so many new ones in these last few years, but I wanted to highlight the Returning Citizens Clinic, which is a new organization within a partnership that really supports people coming back into society after being in a correctional facility. Next slide. So how do you find out about these? There's a host of information online. You can connect with your colleagues, but there's also a student organizational fair that happens about a month into school. So you kind of get your feet wet and you see what bandwidth you have when it comes to classes. You get a little bit more familiar, and then you get to check out the student org fair, which is really collaborated with the Board of Student Organizations and us in Student Affairs. And it's a nice collaborative effort to get everybody together and be able to check out a little bit what is out there and what you might be interested in. And there's really a set structure in place here when it comes to that Board of Student Organizations, Student Senate, leadership positions, where it's not just like, if you have 10 organizations, maybe you can do this kind of a little helter-skelter. When you have 130 organizations, there has to be like a really set structure in place, right? With both student leadership as well as the Office of Student Affairs, which oversees this. Each of these student orgs have a faculty member that mentors and is involved in the student organization. So it's also, although I'm focusing on the peer connections here, it is also a nice way to be able to get to know faculty in a different way. Next slide. All right, so it just gives you a sense of some of the learning from clinical skills outside of the classroom. It was fun to be able to hear a little bit about the Clinical Skills Center, and it's meaningful to hear that and learn that in that beginning element of medical school in those the pre-clerkship years, which are not really the pre-clinical years fully at Wayne State, because of the student orgs and all of the opportunities, you can be out there interacting with patients from your first year. Next slide. There's a lot of alumni. We have, as you heard, we have been here for a while, and we have bigger med school classes. And I think with that actually comes a lot of benefits. There's a huge alumni network that that is involved as well with the student organizations. They support us when it comes to funding, and it really is a way to be able to connect with people that have come through Wayne State before you. Next slide. And there's also at Warrior MD houses, there's leadership within the each of the houses for medical students as well. And so this is a way to be able to, despite the size of the school, you've got a smaller community within that bigger size. With here's some of the events that the houses have participated in over this past year. Next slide. How big are the houses? Goodness, I think there's this. Hold on, I'm blanking. Yes, it's about 40 to 50 people because I think it's about 8. Is it 8 or 9 of them? Yeah, students will know best. All right. But the other thing I wanted to talk about is the opportunities. We focus on the community within our backyard, right, for the Detroit community, but there's really a lot of opportunities both kind of closer and further from home. So this is a trip from the WHSO to Mexico. And I have a few quotes from one of the students that came there and a little bit about what they learned, but I'm going to go through these quick because I know that some of these are in the student section, so you'll be able to inform this more. Next slide. And then I think a really nice connection from a professional development standpoint is that a lot of what you do through the student organizations can really help not only the kind of close by community, right, but have an impact on the medical community, because being able to develop something like, for example, the street medicine, and this was a novel idea to have street medicine have a consult service. And to have a team in the hospital be able to connect with a student organization. These are the kind of initiatives that then are sent to medical conferences that are presented by students from our group and shared out. And I think it was significantly over 100 students in this past year that had an opportunity to present scholarly work in conferences, and a number of those presentations were really intertwined with what they were doing with peers and with faculty through some of the student orgs and student engagement. Even next week we have the Medical Education Research and Innovation Conference that's coming up, and we're really excited to be able to see what our students are doing and how they connect those student orgs to med ed. Next slides. All right, so there's a lot that's going to happen in the next 4 years. These are a few of our graduates from the class of 2025 ready to go into the Fox Theater, which if you're not from Detroit, you are in for a treat when it comes to the Fox Theater in Detroit. I don't think there's a better place. But welcome again. We're really excited for you to start the journey. I look forward to seeing many of you and meeting you at the start of July. These are just some of the things that you get to do in the next 4 years. And nicely with student affairs, really collaborating with every single one of the student organizations. This is a nice alignment with our objectives in the Office of Student Affairs. Which if you can do the little graphic, thank you. Really, these are our main goals, to make sure that you've got the best student experience possible, to really create that culture of wellness. Medicine is hard, learning medicine is hard, but you have to do it in a place with some good people and some supportive faculty. Provide access to student services, build that community, and really foster your development, not just as a future physician, but as first and foremost as a person. So next slide, thank you very much for your attention. And Wayne Trained is our a newer way to describe what it means to be from Wayne. And yeah, when we talk about being Wayne Trained alumni, like everybody gets it. They all thought that it was such a cool way of describing the training here that Dr. Chadwell, our Senior Associate Dean of Student Affairs, created. And so Anyway, welcome, all right, and again, hope to see many of you very soon when you'll get to experience what that is like as well. So I turn it over to, I believe, the student presentations, correct, Kristen?
Yes, thank you
Yes,
so
thank
much, Dr. Wino. Christian, if you wouldn't mind doing the honor of introducing your fellow Warrior MDs.
Okay, awesome. So that was fantastic. Thank you. So yeah, next up for this part of the presentation is just hearing a little bit from some of my fellow classmates and colleagues. And so first up, we're going to have Bruna. She's going to speak about the Amigos Medicos Clinic. After that, we're going to have Zachariah. He's going to talk about the World Health Organization. Afterwards, Ahmed is going to talk about Robert Frank, which is another one of our student-free clinics. And then David's going to round us out here talking about the wonderful outreach program of the Detroit Public School Health Corps. So lots of perspectives for you guys to enjoy today. Bruno, did you want to go ahead and get us started?
Of course. Hi, everybody. It's so nice to see each and every one of you here. And as you had the opportunity to see, Wayne has many, many organizations that you guys can get involved with. And one of the biggest reasons why I chose to come to Wayne was the opportunity to actually be able to go out into the community and truthfully make a difference in those populations that need and gain from all that they have to offer to us. So, one of the things that we talked about a lot that was mentioned during P4 is the opportunity to learn about culturally responsive care. There were a lot of questions in the chat talking about language opportunities, right? We do serve a diverse population, and Amigos is actually a Spanish speaking clinic where we have two physicians that come with us, and their first language is Spanish. And we're here to serve and provide primary care to the Latino community around Detroit. So we meet in the first and the third Saturday of every month, and we have a family medicine physician that will come in and will see patients. So there are a lot of patients with chronic conditions that do not have access to insurance, and our goal is to truly be able to fully serve them in the best way that we can. We were talking about clinical skills and gaining that clinical experience from day one and truly becoming better physicians. You get the opportunity once those patients walk in to get a history from them. So, like Christian was talking to you guys about, it's really exciting to be able to apply those skills. For the patients that do not have insurance, there are a lot of social determinants of health that you guys will come across, and that will help you become more competent physicians as you're moving forward. So learning how to address those is really important, and the free clinics kind of give you that opportunity. Once you move forward during your M3 year, you can still be working with the student run free clinics, but now in a more of your physician role where you get to work with that attending, coming up with a plan, understanding the logic that goes behind it. So those are some of the cool opportunities that you'll kind of get through that. At Amigos, we do run lab tests for our patients for free. They're able to get all their chronic conditions taken care of as they're moving forward, making sure that those things are controlled. And if there is anything else, like if our patients are in need of food, we have a team that works with them for that. We work with other student organizations, Sight Savers, so they can get free eye care. So as much as we can get everybody together and really try to provide that holistic care to the patients, that's our main goal. Trying to bridge that language barrier with our Spanish-speaking physicians and give our students the opportunity not only to practice the things that they're learning in the classroom, but also just being able to go back to their community and give back and even practice language skills if they do want to learn Spanish or any other language that they may be interested in. We work really closely with LMSA. So they just went into a conference recently in Chicago, and they had the opportunity to present some of the things that we've been working on and how we can address those. So it's really exciting. We have many amazing opportunities for those who are interested, and funding opportunities have allowed us to really grow and Wayne to really support us as we're trying to go back to our community and give back. So yeah, thank you all very much for being here today. And I think next we might have Zachariah.
Yeah. Hi, everyone. As was mentioned, at Wayne, we have a World Health Student Organization, which is based on the idea of the World Health Organization. So as you can imagine, our focus is global health. It's things like epidemiology, health disparities, and What we do throughout most of the year is we host speaker sessions. So it's not only physicians, but professionals will come in. They'll talk about issues like tuberculosis, breast cancer, and how rates of different diseases are different in different countries and why, which I think is very interesting. And we also talk about international organizations like the WHO. We talk about how that's changing right now. You may have heard that the state of world health and global health is actively changing as different countries change their relationship with these institutions, like the United States. And one of our biggest events of the year is we organize a trip to another country to observe medical professionals in that context. So this we usually in the past few years we've done it in Mexico. This past year, we organized a trip to Oaxaca, which is in southwest Mexico. It's one of the poorer states of Mexico, and we spent 1 week. For every day, we'd wake up and we go to different locations, different clinical sites for the mornings. And then in the afternoons, we would take a Spanish lesson, explore Mexican culture, Oaxacan culture, learn about traditional medicine. We had a lot of guest speakers. We had some physicians come in and speak with us. We had interpreters as well. So we really got to a very unique perspective on another country's medical system. And I was very impressed with the Mexican medical system in many ways, despite the limitations, especially in Oaxaca. So we had a group of, I think it was maybe about eight students who went down. And some of the sites that we were able to visit were an urban, it's essentially like an urgent care, which you can see on the left. It's called like Unidad de Salud. And it's like anyone can go in there and get free treatment, almost anybody. And it was very interesting to see the different methods that were employed there, how their facilities were different from American facilities, and the universality of their system. And on the right, you can see a more specialized and more rural center, which is for pediatrics. So this was a regional center. People were driving like 3 to 5 hours in some cases just to get their kids in at this pediatrics facility. Again, it was free to the patients, which is incredible. And we got to see all sorts of diseases. We got to see different techniques that I had never seen before, machines to help with locomotion for patients with cerebral palsy. It was really incredible. And I had a fantastic time. My Spanish was not very good going into it. I can't say it's amazing now, but I did improve. I can say that much. So if you're interested in exploring other health systems around the world, if you're interested in maybe exploring a career in global health, I would highly recommend you check out the WHSO. I think it's very unique that you can actually go to another country, experience all that during your MD career, like before you move on after residency. That's when some people can do those sorts of things, but you can do it right when, in your second year at medical school. Thank you for your attention. I hope I see some of you applying to this board of WHSO.
All right, thank you, Zachariah. I think next up is Ahmed talking about the Robert Frank Student Run Free Clinic.
Hi, everyone. Sorry, my camera's decided to give up on me with Zoom. But without no further ado, we'll get on with this. And sorry if it's noisy. Everyone's grabbing a bite right now for Anatomy Lab. But so the Robert R. Frank Student Run Free Clinic is a fully student-run clinic that provides healthcare services to the uninsured individuals of Detroit. Now, one of the beautiful things about Wayne is they work really hard to try to get you acclimated and working with the community here in Detroit. Because I mean, at the end of the day, the healthcare is for the community here. So at the Robert R. Frank Student Run Free Clinic, you get to learn a lot about the social determinants of health and their interplay with a patient's well-being. And in the clinic itself, you can start off from your first week of medical school, and you're coming in and going in a care team and helping see patients with preceptors and upperclassmen, and pretty much we have, we have lots of resources for our patients in the clinic, whether it be, we pay for their labs, their prescriptions. If they need transportation to the clinic, we pay for all that out of pocket, and we get a lot of our funding from the alumni funding here at Wayne. So a lot of these student organizations, especially the Robert R. Frank, we have lots of support from the school. Is there a next slide here? So here's just our board. There's lots of leadership opportunities, and it's really nice when you get to work in a team with all your classmates, especially outside of the class setting. Next slide, please. And so the SRFC, we work with many different organizations, student orgs, such as Site Savers, as Bruna mentioned. We have Fresh RX, we're providing food resources for those who need it. We also work with lots of the churches nearby to make sure that we're increasing our patient population and getting that care to those who need it most. Is there another next slide? Yeah, so just to echo, we provide fully comprehensive care to our patients. And it might be overwhelming. You might be thinking to yourself right now, how am I going to do this as an M1? And I barely know how a cell works. But trust me, there's a lot of hand-holding in the process. We were all in your shoes at one point, and you live up to the expectation of the standard. Yeah. Next slide. So we have 2 clinics a month, and we have a very diverse patient population here in Detroit, and that's also seen with the translators who are mostly our medical students who are coming to help out. And usually the language is French, Wolof, Spanish, and Arabic. And yeah, I think that is it for me. Thank you.
Hello, everybody. I'm going to be talking about the Detroit Public School Health Corp. So you can go to the next slide. So this is actually a newer organization that kind of got off the ground in the last couple of years. But essentially what started it was when there was a student athlete playing basketball in Detroit and ended up passing away during a basketball game. And this unfortunate event just kind of made us realize that this is a part of a bigger picture, that there's actually no athletic trainers on site for any of the Detroit Public School high school teams. So they're basketball, volleyball, soccer, whatever it may be, they don't have athletic coordinators because that's not in the budget for the school. So what the response of Wayne State students was to create an organization to combat this. So if you want to go to the next slide. So what we actually do is we partner with local hospitals, Wayne Pediatrics, the Detroit Medical Center Orthopedics Department, and the community district for the school system. And we train health leaders or medical students to actually be at the sideline of these basketball, volleyball, soccer, softball, whatever, all these games for 20 Detroit high schools. And you end up getting trained in musculoskeletal injuries, how to triage an emergency patient. Patient comes, they get their head hit, do a concussion protocol, see if they need to sit out to play or if they follow up in the ER. You also learn how to communicate because you have on-call physicians and residents who are prepared to get your text at any moment. Just the other day, we were at a football game. A kid, sprained his ankle. We send the history of a present illness to one of the on-call attendings, and then they kind of lead us through, what to do next if we need to send the EMT, if they needed, just follow up in the ER in the clinic. Next slide. And even though this is a new organization, we've already made great strides in this recent fall with like the football and soccer season. But just last year is our first year of like a ongoing organization. We've done almost 600 hours of sideline care, which means we had about like probably 40 to 50 medical students volunteer 600 hours of their time to be at these games that otherwise would have had 0 hours. And while we were doing it, we ended up seeing 89 injuries that would have went to the hands of coaches and parents who have no medical training and would have not known what to do. We actually offered over 300 free pre-participation physical exams. Obviously, that's a financial burden. It costs like $5,200 for a family to get that for their kids. and sometimes they don't. And we offer that for free. So you can see that's one of our sports physicals flyers. And then here you can actually see we were on Ford Field as well as Comerica Park. That's for like the football and baseball finals. So those are like fun events to do as well. Next slide. And then because it's a new organization, we noticed that there's a lot more disparities than just athletic coordinators with all these high schools. So, we're hoping to expand to more schools in sports. We've actually doubled the size of our board in this last year. We're actually funding for hydration resources because a lot of these schools don't have enough hydration. They run out of water by second quarter. Mental health screening protocols, we actually like have a study going. We did like mental health screening at the physical exams, trying to get them help. Literacy education. We're creating programs with local professional athletes to kind of teach the kids, how to properly hydrate before games. And we're also working to scale this to other schools and cities because Detroit isn't the only city that doesn't have, the proper help it needs. That's our Instagram if you want to look at our Instagram, and then email if you want to reach out. But yeah, that's it for me.
All right. Thank you so much, everybody. I think that everybody really enjoyed that, I hope. And I think it definitely shed some enlightenment about some of the things that we do at Wayne State. And as we've mentioned before, there's over 130 student organizations who are all doing different things, a lot of them out in the community. So what you've seen today is just sort of scratching the surface. So yeah, definitely take a look at all of the things that we have to offer. And I hope you guys enjoyed that section. So next up, I believe we are going to switch over to the Q&A.
Yes. And I saw many comments in there. It's always amazing to me. We highlight various groups and various webinars all the time. And every time I'm just floored by the passion and compassion and motivation of our students. And one of the comments, there was some excitement about a student just kind of showing interest in starting an organization, and the students just kind of getting this started. And I wanted to ask you, Dr. Waino, if you are still able, with regard to if students have an interest outside of the 130 that already exist right now, what is the possibility of new student orgs after that?
It absolutely is possible. There's gotta be, some paperwork filled out with the School of Medicine and collaborated with main campus. But as you can see, I mean, there was new ones within the last couple of years. So it is possible when it comes to the details. I would not get ahead of it. Like, get through the year, get through the anticipation, start, see what's here, what's of interest to you, what sparks your passion, and share with us if you have ideas that are not here yet.
Just kind of going around, thank you, Dr. Waino. With regard to the students, how many, by show of hands, or if you want to comment, how many student orgs are you involved in? And how do you, work your time as a med student with all these other commitments as well? Anyone want to chime in?
Sure, I can chime in. Oh boy, I think I'm involved in the board of three things, and then I'm also involved with MD Ambassadors, which helps to put on stuff like this. Overall, I mean, it's definitely difficult at first, but I think that Wayne does a really good job of getting you used to the rigor of medical school before you start getting involved with all of these things. So like you don't really start applying for board positions until your second block of medical school. So like that's after like your first block, you've done your first set of exams, you kind of understand what's going on, and you've been in medical school for about 3 months. And board transitions don't really occur until about 6 months into medical school. So by then, hopefully, you sort of come up with a system of how you like to organize your time and things of that nature. And the transition shouldn't feel quite as shocking as if maybe you like started doing extracurriculars on day one. What I definitely will say though, that like a lot of boards are very flexible, and like a lot of them are like your hours are kind of what you make them out to be. For example, I'm involved in a couple of interest groups, like the ENT interest group. There will be weeks where I'm working for like 5 hours a week on just ENT interest group stuff. That could be like planning events, that could be, setting up shadowing opportunities, like things of that nature. And then there might be a couple of weeks, like this week we had our exam, and I haven't really done anything for my board. So, it's just a combination of, just like good time management and just understanding that a lot of these commitments can be pretty flexible. I don't know if anybody else wanted to chime in on that.
I can hop in for a second. I think the best thing I like about Wayne State is the only reason you're on campus is if you're actively engaging with students. And what I mean by that is lecture material is all asynchronous. You do that on your own time. You're only going to come on campus if you have to work in a small group to figure out a biochemistry lab assignment or do histology slides or dissect with your anatomy partners. And by doing that, I mean, I think your first year, I mean, maybe a couple hours, 2, 3 hours a day during the week, you're on campus for a class or something. Those wrap up pretty quick. You figure out when you want to do your coursework, and you fit that in when you study best. I personally studied really good, from like 5 to 11 p.m. and like that was like a really good time for me. And it's different for everybody. I know people that study whenever. And because of that, you're actually able to do way more than other medical schools where they have, strict, 8 to 5 lectures. And then after these lectures, they have to study on their own anyway because they couldn't really learn in that kind of lecture format. Um, so that kind of helps you.
Sounds good. Thank you very much. I'm seeing, and I usually am quick to pull up my website and share my screen, but I don't want to get off of this presentation. So I know that there's a big list on the Student Org site, on the Student Affairs website of all of these organizations. I can scroll back in the presentation for the QR code that I popped on those slides as well. But there's a question about, are there interest groups for most specialties?
Yes, I can definitely endorse that. If there is a specialty that exists, there is almost certainly an interest group for it. We even have things like aerospace medicine, which honestly I didn't really know was a thing, but it is, and they're like active in doing their thing. And honestly, there are a couple of specialties that actually have almost multiple interest groups. So I know for like the orthopedics side of things, like orthopedic surgery, you have the orthopedic interest group, and then you also have I think it's like the like Ruth R. Frank or something like that interest group that is specifically for increasing representation in orthopedics amongst women. And so like pretty much any interest group or like any specialty that you can think of, there's an interest group for it. And if for whatever reason there isn't, as we've mentioned earlier, it is pretty easy to get the ball rolling and get that started.
Thank you. And I'll just keep going here on these questions. With regard to interdisciplinary work, so are there specific student orgs that you can think of, or clinics or anything that are good examples of an interdisciplinary approach to healthcare from med school to other students in other areas and healthcare practitioners? Anyone interested in chiming in on that? So I know we have the CHIP.
Um,
Sorry.
I guess I can chime in on this one too.
Thank you.
So like there's actually a couple of things. So first and foremost, like a lot of these clinics will have like interdisciplinary support. So like this could be interdisciplinary in terms of like different services being offered. So what I can say is, for example, like Sightsavers and Lions Hearing Clinic kind of both represent sort of like more of like ophthalmology slash optometry, and then Lions Hearing representing audiology, respectively. And so like these guys will actually go and like rotate at different free clinics. And so like for like for example, like whenever like Sightsavers is like at a clinic, they'll be doing like eye exams, things of that nature, sort of, giving sort of like ophthalmological care. I guess. And then like Lion's Hearing Clinic will rotate to different clinics, and whenever they're there, they'll do audiology screening. So that's an example of interprofessionalism. In terms of other things as well, in second year, we're actually doing an interprofessional class right now. And that is when you get a group of three medical students. Typically, you'll be assigned with a PT student or a pharmacy student. There's also a nursing student, and all of you guys come together and you actually do a mock healthcare visit with a volunteer patient in the community. And so that gets you quite a bit of practice with like real world application of like actually interacting with different healthcare disciplines. Additionally, as well, this is something that's new, but our director of clinical skills, she recently started an initiative. It is a elective class, I believe, technically, where you sort of expand off of that interprofessional visit and you actually go to classes with these different disciplines. I think almost once per week, particularly in October, November. And so that is a newer program and just another way in which you can get involved with different disciplines in terms of specialties and with different roles, right? Like nursing, pharmacy, etc. Hope that answers your question.
Thank you so much. It does. With regard to each, maybe one of you students, can you talk about maybe how is your participation in your outreach efforts or your student orgs shaped or kind of helped shape your interest moving forward in any kind of specialty or career direction, if at all?
I can hop in. So, done a bunch of different, clinical volunteering. I think with DPS, just because I spent a lot of time with that, it's been super nice to kind of learn a lot of those MSK exams alongside, we work very closely with the orthopedic residents at DMC as well as the attendings. Running this organization, we have to like be in close ties. So, we see them a lot and, they show us the different MSK exams to kind of diagnose on the field and kind of getting that experience definitely influenced my own interests. Now, before starting medical school, I wasn't like super interested in orthopedics, but now kind of getting into it, I was like, oh, this could be something interesting. And then once you kind of get to talk to them and work with these attending physicians and residents who are helping out of these clinics, then you kind of build, networks to kind of get involved with some other research opportunities and do so many different things than just the volunteering of the few hours that you went for. So that's kind of how you spread your wings, spread your horizon, and spread who you are talking to in the field.
Did anyone else want to chime in on that? Okay. I am seeing some more questions here. Let me see. How about mentorship or support among faculty or alums within your efforts? Have you experienced that in your student orgs?
I can definitely say that with a resounding yes. So as I mentioned earlier, I'm part of the ENT interest group as well as the plastic and reconstructive surgery interest group. And a big part of what we do there is we actually reach out to physicians. These could be alum or otherwise in the community. And, like we try to get in touch with them to maybe, set up shadowing opportunities, research opportunities, as well as just to have them come in and talk about their experiences. And so we've had a few events of that nature, and they're always very supportive. For example, we had a facial plastic surgeon at Henry Ford come in a few months ago, and he helped us set up a suture clinic that was like specifically geared towards talking about some of the more aesthetic considerations when you're doing suturing and certain techniques that can be conducive to that. And so like he started off giving like a presentation, he showed us how to suture, he was rotating around, and then at the end, like he left his email and like anybody who was interested in talking to him more about the specialty, doing shadowing, doing research, he was there. And so like there's quite a bit of faculty support out there. Another thing too, in the ENT interest group, we have recently been getting, sort of in greater touch with the program director of the ENT group as well as a lot of the residents, and they're always very supportive and willing to provide mentorships to students. So I will definitely say if you're interested in a particular specialty, joining an interest group is a great way to get in contact with alum and faculty who will be instrumental in your journey.
Thank you very much.
I
Go
would
ahead.
also like to add, if it's okay, I am interested in GI, for example. I'm part of the GI interest group, and one of the biggest things that we were able to do is bring in the program director for GI that works at Henry Ford. And she came in and she spoke to all the students who are interested. What are they looking for? What are things that you can do right now that will help your application later on? Not only that, but she offered us opportunities to shadow, to really get into what GI is all about. So I think those are things that are very unique. And if you reach out to Alumni Affairs, they're more than welcome to get you a list of physicians. And as Dr. Wino talked about, we have a huge class, and there is a huge benefit to that. We have so many people that we can reach out to all across the country that are there to help you succeed. So you get many amazing opportunities through that.
Thank you. I just have one more question, and I'm not sure if any of you on this call are involved. Could any of you speak with any of the advocacy-oriented groups on campus, like AMA or anything else that we have here on campus, what that looks like here, opportunities available, and experiences? Are any of you
I can
involved?
talk about, I suppose would Student Senate be a good example?
Yes, that'd be great.
Okay, so like right now, I serve on the Student Senate for our class, and I'd say a big positive of Wayne State is that the faculty take a lot of student input, and there is a lot to go around. The students are always having something to say, which is good, and that's because they feel comfortable to say these things, because whenever they do say them, they know something's going to happen about it. So, like, for example, for the Student Senate, we have meetings every other week for a couple hours, and then another meeting with the dean every other week where we kind of relay student concerns to him, what faculty are saying back to us. We kind of get concerns on the curriculum. We make sure if students aren't feeling, they have enough resources for their health and wellness, we make sure those are supported. We make sure all these different facets of, whether it's complaints or things just to make your life easier are accounted for. And that's because we have, you know, the facilities to do it and the faculty to be, receptive enough to hear us when we do, have these queries or interests. So I think, AMA, I'm not personally involved with that, but I know like those guys, they do a lot as well. We have people we designate to go to, several conferences a year, for AMA, and then also we have, various OSR representatives. They meet with different medical schools, representatives from different medical schools and see what they're going on that's good for them. And then we kind of share insights to, various different things. But I think a lot of great opportunities here.
Thank you so much. Thank you to all of you who attended today. Thank you so much for our wonderful panelists who are still here with us, and who maybe had to jump off. And Christian, thank you so much for serving as our co-host today. I'm greatly appreciative of that. For sure, if you have not checked out our website, med.wayne.edu/admissions, scroll down to the footer and click that YouTube channel for our webinars. We definitely go into depth on a number of different items on various webinars. So if you haven't had a chance to check those out, they're the best place. Every webinar features a great group of students and alums and faculty, just as this did. So it's a great place to get a lot of personal experiences and insight from the people who know it the best. So thank you so much for your participation. And if you have any admissions related questions, please feel free to reach out to us at mdadmissions@wayne.edu. And we wish you a great day and a great weekend. Thank you so much.